Tie the tourniquet with a half knot 8 to 10 centimeters above the targeted insertion site. Place the tourniquet flat against the skin and bring the tourniquet ends together, overlapping one another. Stretch the ends of the tourniquet and with one finger, tuck the top tail beneath the bottom, directing the end away from the puncture site. When evaluating a vein for cannulation, inspect and palpate the available veins. Gently tilt the extremity or adjust the angle of the light to reveal better the contours of the vessel. To palpate a vein, place 1 or 2 fingertips over the selected vein and gently apply pressure. Release the pressure to watch and feel the refilling rebound of the vein. An ideal vein feels round, firm, flexible, and full. Once you have selected the vein, clean the site with a chlorhexidine-based antiseptic solution, using a back and forth motion. Allow the area to dry completely. Do not repalpate the area. If a larger gauge catheter is used, the site may be anesthetized with a local injection, topical cream, or ethylene glycol cryoanesthesia. To prepare the catheter, inspect the metal needle and plastic cannula for any damage or contaminants. Both should be smooth. Spin the hub of the plastic cannula to verify that it moves easily off the metal needle. Do not move the tip of the cannula over the bevel of the metal needle, as this could damage the end of the cannula. Superficial veins are displaced easily and need to be stabilized. Use your non-dominant hand to apply traction to the skin distal to the venipuncture site. If the catheter is placed in the dorsum of the hand, grasp the patient's hand with your non-dominant hand, fingers beneath the palm. Pull downward to flex the wrist, and use your thumb to keep the skin taut. If a forearm vein is selected, use your non-dominant hand to encircle the patient's arm. Place your thumb on the skin distal to the venipuncture site and pull down. Regardless of the venipuncture site, always maintain a firm grip on the patient's hand throughout the procedure. With your dominant hand, insert the metal needle bevel up at a 5 to 30 degree angle through the skin and into the vein. The angle used to approach the vein is dependent on the depth of the vein. A lesser angle is required for superficial veins. Do not insert the catheter too deeply, as this risks penetrating the far wall of the vein. When the catheter enters the vein lumen, watch for the initial flashback of blood, which will slowly fill the catheter chamber. Once the metal needle and plastic cannula are in the lumen, lower the catheter so that it is almost parallel to the skin. Hold the end of the catheter with the thumb and index finger of your dominant hand. Maintain tension on the vein and the skin, stabilize the needle, and carefully advance the catheter into the vein. When the catheter has entered the vein lumen completely, remove the tourniquet. To prevent blood loss from the open plastic cannula hub when the metal needle is removed, place direct pressure over the vein proximal to the end of the catheter, and place a gauze pad beneath the cannula hub. Remove the metal needle from the plastic cannula and place it in the sharps container. Never attempt to reinsert the metal needle into the plastic cannula. Doing so may shear off the plastic cannula, releasing it into the bloodstream, resulting in a possible embolus. Make sure that the tourniquet has been released, and confirm that the cannula is patent by flushing it with normal saline. The volume used depends on the size of the vein and the gauge of the catheter. Check that there is no swelling, redness, leakage, or discomfort around the insertion site. Attach the intravenous fluid tubing to the cannula and start the fluid infusion. Ideally, you should secure the cannula with a transparent occlusive dressing placed over the cannula hub. Confirm that the hub of the cannula is clearly visible through the dressing to facilitate monitoring. After securing the cannula with tape, loop the intravenous tubing and secure it away from the insertion site. Looping the tubing may prevent accidental displacement of the cannula, decrease cannula manipulation, and lower the risk of venous contamination or irritation. It is recommended that you write the date of insertion on the dressing to facilitate determining how long the cannula has been in place. To reduce the risk of infection, continue to review the indications for peripheral intravenous catheterization and remove the cannula as soon as possible.